physical therapist. Can I come in?
Yes.
Okay. Hello. So, my name is Bianca. I'll be working with today. Can you confirm your first and last name for me, please?
Yes, my name is Jamie Whaley. My birthday is July 26, 1961.
Perfect. And then, where are you at today, Jamie?
I am at the hospital. Yes,
The hospital. Awesome. And then, do you know what's today's date? Do you know where we are today?
Yes, it is December 4th. December 4th, 2004.
You got it. So, I see that you're here because you had a recent surgery on your left leg. Is that correct?
I did, yes.
Okay. Have you been having any pain right now?
Yeah.
Yeah.
Definitely.
Not sure. Okay. Okay. Well, today's plan is for me to address, the recent surgery to get you up going and walking. We'll do some balancing, some walking things, different activities for therapy, okay, to get you better. Is that okay with you if I work with you?
Absolutely.
Awesome.
And then have you had any other surgeries or any other?
So, I've noticed you also have a history of diabetes and hypertension, is that correct?
That is correct.
Are you taking any medications right now?
I think so, but I can't remember off the top of my head.
Okay,
What they are.
that's all right.
So I saw on your chart here that you're not having any.
Okay, and the surgery was yesterday?
The bathroom.
Yes, yes.
Anything changed since then?
It's a pretty big incision there, huh?
Yeah, they really went down my thing.
Yeah, I'm just gonna inspect, I'm gonna count right now. I see 1, 2, 3, 4, 5, 6, 7, 8.
And then before.
Well, 13 stitches or sutures, right?
Yeah, I think so.
I counted, yeah.
I know that.
Yeah.
I have a wife. We live together.
Right.
It's like a standard home.
Do you remember any of the precautions the physician told you, the do's and don'ts?
I do not know.
Upstairs.
All right, so you
And
are
a couple to get into the house. Other like light.
you are able to bear weight on the left leg, but only to your tolerance.
There's a wall that I can.
Okay? Yeah. Right leg is good, and then left leg here, you can apply weight what you feel is comfortable for you. Okay, I don't want you to pass a painful range where you're putting too much weight on it, okay?
Alright.
So those are our precautions we'll keep in mind for the session. Alright, and then what are some of your goals?
Basically to, not have pain anymore and, avoid.
What are your goals for?
I was hearing talks about amputation.
No pain, no amputation.
I don't want that at all.
Yeah, I don't blame you.
At all.
Okay, we'll try to avoid that.
Get more functional.
What were you doing? What were some things you were doing before the surgery? Were you able to take care of yourself?
Yeah, I was pretty good with, being by myself. I sit really, I kind of like sit at home really don't do that much.
Gotcha.
Throughout the day. I was able to get around my house.
Yeah, you're able to get around the house, do your own things. And then obviously now you can't do that, right?
Is there anything else that you would like to?
And then obviously now, we're unable to do that, so that's been affected.
It has, yeah, it's not,
Have you gotten up since the surgery yesterday?
And you said yesterday.
Yeah.
I have not.
Were you using a walker before this?
I was not using anything, no.
So you have not gotten up yet, no history of a
Before we
walker.
get started here, I just want to go over your precautions that you had. I know you said you don't really remember much. You don't remember your precautions, correct?
Okay. Okay, all right.
So for your external precautions, since
I'm gonna take some vitals first. Is that all right with you?
things that I don't want you to do because I'm going to try to do
On this
right.
sorry, on this left side, do you have
So I don't want you to lift more than 5 gallons there.
Nope, nothing that I would know.
I don't want you to lift
and then incision section?
Not that I'm aware of.
And then history of cancer.
And then I don't want you to
Nope.
push or pull
Okay.
with your arms. And no going back. So as we're throughout our session, we'll make sure we're following what reminds you, of course. So,
Okay,
first I'm just gonna test you.
You're gonna feel the blood pressure pump up twice. The first one is for me to get a baseline of it. The second pump is me actually taking your blood pressure, okay?
Alright.
Actually, I'm gonna take your I'm gonna take your vitals here. Have you had any history of cancer?
No.
Any wounds or infections in either arm?
No, just a big hole in my stomach.
And then any devices, any like diabetes, sports or anything? Do you prefer an arm that I take the blood pressure?
No.
So, motor screen, so I'm just gonna have you start from your blood
Blood pressure, 128/76.
Was that no about you?
It would like to choose on this side.
I'll write that down.
88.
So I'm going to use
Oh, 296.
And your heart rate?
Heart rate, 78.
Alright, so next, I'm going to have you close your eyes, and then I'll measure on the first body, your legs, and then I want you to tell me where you're
Okay. Very good.
How are you doing today otherwise?
Okay. Have you had any issues with going to the restroom or eating since the surgery? I know it was only yesterday.
Nope, nothing like that.
I'm just gonna take a little bit of a closer look at the incision.
Okay.
Kind of see some swelling going on. It looks intact. No drainage.
Does your doctor
Yes, brushing. Yes, probably intact as well.
yeah, it was in your chart, so I think they were trying to
Any pain when I'm slightly just
Yeah.
just shooting?
Just kind of, yeah, kind of just.
Let's just look for it. Yeah, I have some redness. Okay. All right, I'm gonna test your sensation, okay? So what that means is I'm gonna use this cotton ball here throughout various parts of your arms and legs. You're gonna close your eyes, but you're just gonna tell me the general area where you put it, okay? I will take off your socks for this, okay?
Yeah. Sounds good.
So I'm gonna just slightly push this on against your face. That is what you should feel. Go ahead and close your eyes.
I feel on my left
So
arm.
I'm just gonna put this cotton ball in different parts of
My
your
right
body,
arm.
and you're gonna let me know where you feel it.
Kind of by my right, left arm.
Felt that? Alright, so I'm gonna close your eyes.
Left
You're
arm?
gonna tell me where you stop.
My left middle finger. My right pinky. My right thumb. My left pinky.
No dizziness or lightheadedness.
My left inner thumb.
Shortness of breath or anything at the moment.
My right inner thumb. My right knee. My left knee.
We'll do some breathing exercises later to help with that, okay? Okay, close your eyes.
My
You're
right
just telling me where it is and
heel.
how much time.
My right big toe. My left
Can you tell me
side of
where
the
the body
leg.
as well?
My left heel. My left leg tuck.
Okay, go ahead and open your eyes. Good job.
How do you feel about
Okay, you guys in your eyes. Good job
Just sit
there.
up, I'll support your back here. And I want you to slide this leg into
So, before we get up here, I'm kind of gonna look at that room.
I'm gonna take some measurements here.
All right.
Okay. About 5 centimeters there. And then first right into do a small circulation test. Alright, looks like it's healing well so far.
Next leg, I want us to try. Just while you're sitting there, I want us
I'm
to
gonna put back on your socks.
test some of your balance while sitting. So here's where it may be, but all I want you to do is kind of reach out with your right as if you're going to grab something and lean and shift your weight. Then I want you to come back to neutral.
Alright, I'm gonna quiz you. You remember your precautions before you get up and moving?
Oh, correct. No, I don't.
Alright. So I don't want you to lift more than a gallon of meal. I don't want you to raise your arms past your shoulders. And I don't want you to push or pull with those arms. And I want you to keep your arms
So I'm gonna get a
close to your body.
baseline measurement
And
of
don't go backwards. Okay? Get up here.
Of your
I'm gonna
leg.
help you up. So you don't push through your arms or anything. We're gonna turn towards
Is it okay if I just lightly mark your skin?
Yeah.
So, should come off.
It was just crazy. He was really trying to bust a helmet, but he kept getting distracted. Now my boyfriend listens to that. Okay, I'm gonna go ahead and listen to some of your heart sounds. So, I am going to be on the screen here around your chest.
So I'm gonna have you turn towards me. I'm gonna help you
As high as
up.
you can up. Relax. This side. You can't come towards me.
How you feeling?
Okay.
Okay? Are you sure?
Just gonna move just like this, okay? You know it's a little tender.
How do you feel?
Any pain or discomfort? Tired.
Tired? Are you dizzy or anything?
Does that make sense? How about the arm on the left side there? No
Like
pain?
holding it or shortness of breath?
Gotcha. That makes sense.
Okay. Alright.
Alright, so you'll be
Sitting
sitting
here,
there.
just gonna suck some air.
Next thing I want us to try is I want to see some of your
I'm gonna put this big ball on you. Do you have any incisions or anything in that stomach area?
I think I'll just start back and do that.
Right, okay, yep. Any, any like tubes or anything?
Just
Any surgery there?
ask you to take another breath. Take a deep breath.
If you keep your arms close, I'll
27. Just gonna bring it over there, lift up.
Sure.
What are you checking again? Listen here,
okay?
Okay.
I am doing some practice, which are
Feel steady, stable?
just a little more
Alright.
hard.
Can I have you pick out your legs for me?
241. I got your baseline measurements there. 1 second while I write those down.
What about tapping on your feet up and down? Any problems or issues there? Anything you're feeling weakness or anything? Weakness everywhere? Okay. And then can you kind of watch for me?
So sitting back down.
And then the other side.
I got your balance back here. Okay.
Sit back up.
Okay. keep your mouth open while you breathe, and if I ask you to take a deep breath.
Okay, is there there should be an increase on this side, is that correct? Or
A little
a little bit of an increase.
little.
And then I'll just check your pulses here. Just gonna lightly bend this. Just check for the pulses here. Right behind here. Same on the other side.
I don't know if we should be moving this.
His leg?
Yeah, I don't know.
You don't want me to bend it?
I'm not really, I don't
Are you
know.
just scared? Did the doctor say not to move it?
No, I don't know if it's a good idea.
Yeah. Well, it is a good idea because you probably don't want to move it because you're fresh out of surgery. We do want to, movement does promote circulation and healing, but if we keep it in this position all the time, it's not going to heal.
Oh, yeah?
Yeah. Yeah, so it's best to move it, obviously not a lot, I don't want you to be in pain the whole time, but at least a little bit movement is good for you. Motion is lotion now.
Yeah.
So I'll just move you, we'll do a little movement. There we go. Is that all right? We'll keep it there for a minute.
Stand up as best you can, and we're gonna work
Okay.
our way.
So we're getting the visual surgery.
Yeah, tell me about it.
We're gonna do
That
one
was all
test
loopy and
before
then I
we
came
get up
off.
and walk in. It's called a 30-second sit to stand. Have you gotten up since surgery?
Okay.
First time not.
So you have not gotten up since the surgery, right?
Correct.
If you need a break or anything, the time will keep going, but if you need a break, let me get my timer ready. I'll be here to support you.
We're gonna sit up. I have a really nice I'm gonna bring it back. So push high, breaks are long. Okay. And then what we're gonna do, we're gonna incrementally, like so, one by one, just bring your leg over side to side so you can sit on the bed, okay? Side by side, I can help you here, you can use your arms to help you there. It's okay, I got you. Breathe through it. You got it. Little by little increments. Nice job. A little bit more towards the front. You got it.
What's hurting?
What's hurting? Whole thing. Yeah. All right. How are you feeling? Are you lightheaded?
Not really, no. I feel
The first step to walking, and then you want to get back to walking.
Same thing as we got our.
Okay. I'm gonna check for your heart sounds.
Okay.
I'm gonna go underneath the gown. Is that okay with you?
Yeah, that's, I get it. She got it.
And I'm gonna take some vitals now and some activities just to see how you react to that, okay? Any dizziness or anything, or was it just hard? Weakness or weak shortness of breath? Or hurt?
Strong heart, very good.
How are you feeling?
So the next activity I want to assess your balance. So we're going to stand up and do various sit ups. So first one, you're going to stand up and take a 10 pressure, just like this. If you would prefer to rest standing between the next step, that's fine, or you can sit down. And then the next one, we're going to do is make sure you're breathing normally. Look kind of next to the other. No water. Okay. And then we're going to do
After you got to feel a little bit better.
Stand tall with me, stand tall.
Okay, you're okay just sitting down here still, right?
Yeah.
Just right behind you. Good lung sound.
push. One foot in there. Okay, good. Do you need to take a break before the next one? No, I'm okay. Let's do one foot. Go in front.
Breathing normally.
One's a little harder. Just a little bit harder. You can have me stand on one leg. No, okay, because that, I don't think I can stand on. Not today, one day, yes. Okay, all right, we can go ahead and sit there.
Are you feeling any symptoms of dizziness or just no or heart rate? Alright, I'm gonna feel real quick to how you're when you're breathing, how you're
As safe as you can, okay? So, we're gonna walk to.
Are you able to bring your knees just up to the tolerate?
hurt.
That one very little bit. Okay. How about this other one? Can you straighten your knees?
How would you describe that?
Nice job. Don't go through pain that's too much. Straighten your knee.
How would you rate it?
How about your ankles going? Your toes going up, your toes going down towards the floor.
Ready?
6 out of 10.
6 out of 10.
Strengthening, kind of feel the normal on your own.
Good. Go
How do
ahead.
you feel about maybe taking a couple steps? I know that's your goal. We're gonna have that walker there. You're gonna lean.
I'm gonna place the ankle around your stomach, okay?
I'm really trying here.
Have any,
Doing great at school.
any other, I'm sorry, any cancer? And then no open wounds? Okay, I'm gonna put this around for your safety and my safety, okay?
Okay, let's sit you down.
When you're doing this, when you stand up, I want you to use that
Take
finger.
a ringer.
I don't want you to use the arm of the wheelchair.
Alright, let's go ahead.
When you're using the wheelchair, I don't want you to pick it up. Remember, when we're looking at a gallon of milk,
How much you rate it?
I only want you to just use it for balance.
Okay, we're gonna go ahead and go ahead and scoot closer on okay, so slightly, we bring those hips forward, one by one, anything more.
You can hold that pillow while you stand.
We are sure, yes, you can do this. I know it might be painful, but it should be able to feel better if you put some weight on, if you're able to move it, okay? I can bring us a walker, that's gonna make you feel better.
No, I don't think I need to walk.
And whenever you're ready, stand up.
You're just scared?
Yeah, it's the
Okay.
first time since.
Yeah. Well, I'm here with you, we're gonna do it together.
Good.
Okay?
I trust you.
Cool. We're just gonna stand, okay? So, sure you don't want walker. I'll have it with us just in case.
Okay.
Use that for balance. I'll take it off. I'll come around to you. We're gonna take 2 squares and draw.
Now, you don't have to use it, but I will just have it there. Okay? Okay, so we're gonna stand up, I'm gonna count to 3. You can use one on the walker, the other to use the bed to stand up on, okay?
Okay.
On the count of 3.
How you doing?
1, 2, and 3.
Turn around.
And remember, this one's only bearing weight when you can do on the left leg, okay? So more on the right, some on the left. Okay?
Don't push through the wheelchair, just use it for balance. We're gonna turn back to bed.
You got good balance here?
How you
Yeah, it
doing
feels,
here?
it feels pretty good. I felt like a little bit like, my head feels fine.
Okay. Yeah. Here, why don't we do some weight shifts? Okay. So what that is, yep, your feet are separated apart. You got it? And then let's just sway side to side. Nice and easy.
Are you sure it's we start that?
Apply as much weight as you can to the left, to your tolerance. We're doing just a few more tests. Three, let's do 10. 4,
You guys are supposed to finish 10:15. You can
5,
go a little over.
6, 7, 8, 9, and 10. Good job here.
We're just trying to keep that documentation time.
We're going to continue standing.
Spilling over to the next one.
All right. Let's go ahead and take a short break, right? Catch your breath. Let's take these
We're
vitamins.
almost there. How are you for even getting up? This is your goal. What we're gonna continue to work on. Couple more steps until you feel that back, right?
Sounds good.
Do you have another pillow, or can I say just for it, so it can zip it on the floor? Thank you.
Like feeling okay still?
Yeah.
Alright, we're gonna take a rest here. How are you feeling?
Really tired.
Really tired. Okay. Well, we're done getting up for the day. So I'm proud of you for even getting up. We're gonna continue to work on that because I know that's your goal, and that's what you need to get home. No problem. So there's your new clean pillow. Okay. So we're gonna have you.
Is that leading there?
I'm gonna keep you up in this position.
Keep your curly up on your feet.
Lay down.
Okay. Relax there. So it did go down just a little bit with some
Some
activity,
breathing exercises, and then we'll be.
but it's not in a dangerous zone where we can't continue. Okay, Jamie? So let me just write those down. Any shortness of breath?
No, I feel all right.
Yeah, those are strong.
This is the best position here, with that pillow and kind of.
Okay, we're gonna stand up. We're gonna do a test together, okay? Just a small couple of things.
Of your
So
scar.
stand up 5 times.
I'm gonna take one
We're
last
gonna do a balance
one.
test and then just walk just a short distance, okay? I'll follow you through it. Okay. So we're gonna.
Do you have any questions for me?
I will be timing you. How many times you can, how long it takes you to stand up?
Can you name those precautions?
So let's get in a good position. Let's go a little bit forward. I'm gonna just spread. I want your feet firmly down. And again, remember, weight bearing as you can on the left side. Okay? All right. You can put the walker. If you get the walkers there for support, we're trying to take it. Okay?
Okay.
All right. 1, 2, 3. First stand. Try for 5 altogether. That's 1.
It's okay. And then just don't raise your arms.
Walkers there for support if you need to, but then you can do it without it. Okay. Last one. Good job.
Yeah, that was good. And then to decrease
Okay.
some of the swelling in your legs.
27 seconds. Nice. Next one, if you're ready, we're gonna stand up, okay? We're just gonna stay in place and I'll tell you to stay. Okay. Stand. 1, 2, and 3. Yep. Up. Up. And then just want you to bring your legs shoulder width apart. Make sure they're even, okay? Stand here. 10 seconds. Good job. Alright. And that's usually the words you're
Remember
gonna
those
use.
precautions.
Nursing instructor.
This is a good position. Keep them with that pillow.
Okay. And I want you to do half and half.
Healing of your
Okay?
scars. One last breathing exercise.
Fancy things.
So I'm gonna put one hand here.
Good. And then push in front of the other.
One hand on your heart. And one hand
What's my time?
And breathe. I want you to
6, 7 minutes.
move this hand and not.
All right, now we're gonna walk. We can use the warmer if you need to, okay? All right, so.
How's that feel?
Okay,
Just go to where you're just about to, right before you're about to feel that hand.
walk. So right leg first, followed by the left leg. Wavering as you can on the left.
Right
okay?
and then left, you said?
Left, sorry, right first and then left.
Right.
That for 10 more breaths.
Wavering as you can on the left side. Okay. Oops, sorry.
Like I said, next, for future sessions, we're
Let me reset the timer.
take off that needle.
All right, we can start again.
There we go.
Sorry about that.
Alright, I'm gonna leave you back in your pillow, and then you could do that exercise just when you
Watch
want
out
to
for the wheels on the car.
today, or whatever you feel like. Any
Start turning
questions?
towards your left
Okay,
side.
here's your call light. You can call the nurse if you need anything. Thank you for your time.
Very good job. Watch out for that cord there.
Like George of the Jungle, watch out
I
for
know,
the tree.
there's so many things here. We're gonna sit at the bed, okay?
Right.
So start turning towards the left. So let me go first.
Okay.
He's a quantification.
I see that.
Oh,
You
want
can start
me to-
turning, yeah.
I see. Okay. Okay.
And then
Very good job. Back it up until you feel the bed behind your legs. Slowly reach back to take a seat.
Yeah, I just said.
Good job here.
Thank you.
Wow, that wasn't so bad. I know the foot probably feels kind of achy, but you did a good job. Record that time.
we'll leave this a little bit elevated.
Thank you.
Yeah. So what I can help you educate on, we're gonna do an intervention to kind of help with the pain. We're gonna lay back down.
He's a good actor.
I was going for it. We told Jim. I got to show up.
So I can just start side lying down. I got your leg here. I know it's purple.
That's good for me.
So what we can do in bed to promote circulation and just kind of like overall reduce pain and to promote the feeling, let's do some ankle pumps. So what that is bring your toes up towards you and down towards the ground.
This?
Yeah. Yes. So that's going to promote the blood flow all along the leg. Just so we can help it heal, just because I know it's still fresh. I would like for you to do this in bed when you're, not in therapy. So at least 3 sets of 10 throughout the day. So a set of 10 in the morning when you wake up, maybe during the day and then at night. Okay. Promote. We'll do those throughout the day.
Pretty quickly.
Takes a while.
Those are all consistent with workday. So
You can continue. You can take a break. Okay? So
So
we'll do those throughout the day.
a little bit less ibuprofen and then just
Okay.
watch for fluid management. And
What were the numbers for those?
78 for heart rate, 96 for O2.
Okay, sounds good.
Use the fluid.
And then as you start to get stronger, we'll apply more weight to the left side, okay? But I'll take what you can give me for the first day. So good job today on that. We'll continue with transfers. And also,
You also want to conserve your energy, so like your activities.
I want to avoid keeping it in the kitchen all the time. So it's good to maybe like let it hang out throughout the day.
Hang out.
Hang off the bed for a little bit, yeah. You can start, I don't want you to do it like full at once, but maybe like little by little. This is like a good start here.
Decreased strength as well.
Just kind of let gravity do some
So these next couple of
of the work here
Okay.
to promote that circulation, okay?
as well.
All right.
Any questions?
All right. I'll do your last set of vitals and then we'll be all done. Do you have any questions?
None so far, no.
And I'll see you tomorrow.
You said your pain increased, is that correct?
Yeah, it did after walking. Now it's kind of died down.
If I fall, so actually, we would take a piece of
This wheelchair is broken.
120.
I see that.
Awesome.
I was looking, I was
Okay.
seeing.
I was gonna say, even
Well,
if
you don't have any questions for me,
I-
here's your call light.
I know.
Call light if you need it,
It's okay.
okay? You need anything, the nurses will come with that call light, okay? All right. I think I'm all done.
Okay.
Yeah.